So this is intensive 1A. You think you know vape, you don't know vape. I'm going to give you a little bit of background here first. So Melissa Markegard is our speaker, and she works as a tobacco prevention coordinator at Fargo Public Health. She received her undergraduate degree from Minnesota State University Moorhead in community health education and her master's degree from North Dakota State University in emergency management. As a tobacco coordinator, she works as a certified tobacco treatment specialist through the Mayo Clinic, helping her clients quit when they are ready. She also works with all of the school resource officers in Cass County within the school, conducting trainings and with teachers and students on e-cigarettes and their dangers. Tobacco prevention has changed significantly in the last 2 years with the introduction of e-cigarettes, especially the Juul and other easy to conceal devices. Due to those rapid changes, many things in tobacco prevention have changed as well. Melissa works continuously to get the message out via media outlets, social media, and presentations in Cass County. As for disclosures, she says that she's indicated that this presentation will not include discussion of any commercial products or services and will not include any discussion of off-label or investigational use of any product or service. It will include trade names to educate on the different vaping devices being seen locally and nationally.
So the Spot the Signs campaign is our brand new campaign at Fargo Public Health, and this particular one is geared towards parents and teachers about the misinformations of dangers of vaping. So today we will be discussing how you can spot the signs, making sure we want you to know how to spot the signs of vaping, to spot the actual vapes themselves. And if you can see this slide, when you look at today's most popular vaping devices, the majority of them look like something you normally would see in a backpack. Okay, they look like a school supply, they look like a jump drive, and we are seeing more and more movement away from the jump drive, and we're actually seeing them look like the shape of a highlighter, or that size. So we're going to look at more of those a little bit later on. But our learning objectives today are going to be the evolution of vaping and how it has changed really rapidly in the last couple years. We're going to talk about marketing tactics and how big tobacco and the vaping industry have really targeted youth specifically. And we know that based on talking to our youth. And then we're going to talk about nicotine addiction and how it affects the adolescent brain. So I ask students when I talk to them, are there health risks when you choose to vape? Is that what you feel? Do you feel like there are specific health risks if you were to choose to vape? The majority of youth say yes, they feel like there are health risks when they are choosing to vape. Then we talk about if their friends influence their decisions to vape and smoke, and really, for the most part, we are hearing that they really don't feel like their friends influence their decision. And we know that isn't the case necessarily, but they really don't, in their minds, they don't feel like it's their friends that influence them. Most of them say it would be hard to quit vaping, and when we start talking about what that actually looks like and what addiction looks like, when you start realizing that addiction is what they are experiencing, that makes you as an adult think, oh my gosh, we really have to help these kids more than what we're doing. So we're going to just jump right into it. The evolution of vapes. So you'll see over there on the electronic nicotine delivery devices, we started with these products called Cigalikes. Okay, they were not super popular. We didn't see them a whole lot in schools. We maybe saw some adults use them to make the switch from cigarettes to vaping. And then we quickly moved into vape pens, mods, and tanks, along with e-liquid or vape juice, or just juice, whatever. That's what the youth are calling it now. So vape pens, mods, and tanks, those are all refillable. They're all chargeable. You have to charge them in order to get them to work. And those were popular in the schools. but not for very long, because then something came on the market that kind of took the vaping world by storm, and it was called the Juul. And if we were in person, I would have said, and what is it called? And someone would have said the Juul, because you probably all heard of it. Maybe some of you haven't heard of the Juul. 100% of kids have heard of the Juul. Okay, I would go as far as to say 100% of fifth graders have probably heard of the Juul. So the Juul is a pod-based system that uses pre-filled cartridges. And really the way Juul marketed themselves and the way the popularity of that product really changed the vaping world. And the kids knew about Juuls before we did. The kids knew about Juuls before our school resource officers did. And really at one point, Juul controlled the majority, like in the 90% of the vaping industry. So that's very hard to come by. You don't oftentimes come upon a product that controls the market the way that Juul did. And then we had something come along that I do believe that the vaping industry and big tobacco saw it coming. It's a national flavor ban. We're going to talk about it in a little bit, but because of that, we have really seen a push into the disposable devices. And we're going to talk more about disposable devices later as well. But disposable devices, I really feel, are very, very dangerous to our youth based on the number of puffs. If some of you were able to join us for the buzz sessions, we pointed out the number of puffs that are in some of these disposable products, upwards of 2,600 puffs per device. At a $10 device, that's a lot of puffs for your money. So we're going to talk more about that. But this has all happened within the last 4 years or so. So vapes, every vape is made up of 4 main chemicals, other chemicals as well, but 4 main ones: propylene glycol, vegetable glycerin. Those are approved for human consumption, not for human inhalation. And a lot of times you'll hear the vaping industry say that. They will say it's approved for human consumption, kind of leading to the safety aspect of it. It's safe, it's approved for consumption. Well, we're not consuming it the way it's approved, okay? We are inhaling it with vape. So you mix propylene glycol, vegetable glycerin, nicotine, salt-based nicotine, which is very easily absorbed into our body systems, salt-based nicotine, and then flavorings. And every time I update this PowerPoint, I have to update the number of flavors that are on the market. And the disposable devices that are coming out we had a lot of flavors before, and now the amount of flavors that we are seeing it's just off the charts. Over 15,000 flavors. Vapes are not safer, in my opinion. That's my opinion. They're all, so if you compare a cigarette to a vape, in my mind, vapes haven't been around long enough for us to know if they're safer. I mean, cigarettes are not safe, don't get me wrong. But just because it uses less chemicals, in my opinion, doesn't mean that it's not going to cause something terrible to our lungs, to our nasal cavities. I was just driving yesterday and with my kids, and we were driving along, and we saw this woman vaping, and she blew this huge vape cloud out her nose. And my boys were like, "Mommy, what is that?" And I'm like, "Nothing, never mind, don't look at her." So, I mean, I think, the usage of it and how people are using these products, we haven't begun to see any kind of long-term effects because they haven't been around long enough for us to know that. So Juul and big tobacco, I am hard on Juul. I fully admit that. Juul is my least favorite company of any company in the entire world. I blame Juul for our entire youth vaping epidemic that we have on our hands right now. But Altria is a big tobacco company. We have 3 big tobacco companies in our nation. They make Marlboro cigarettes. They saw who wasn't using their current products, youth. And so they paid almost $13 billion for a 35% stake in Juul in 2018. So 2018 was a very great time for Juul Labs. That is when they were, controlling 72% of the market. I would venture to guess it was more than 72% of the market. One Juul pod contains at least as much nicotine as a pack of cigarettes, but that's according to Juul. And it literally, it makes my stomach clench to know that that's what I have to work with, as far as I have to put that on my slide so people know how much nicotine is in these things. But that's according to Juul, and I don't trust anything that they say. So research is actually showing us that it's closer to 2 packs of cigarettes worth of nicotine. A lot of the reason for that is because of that salt-based nicotine. You absorb a lot more. Juul pods always contain nicotine. It was a parental misconception there at the beginning, where, it was almost like a rumor, not all Juul pods have nicotine. Yes, they do. All Juul pods have nicotine, as they are manufactured from Juul. At its height, Juul was producing 60 million pods a month. I can't even imagine the environmental impact that these products are going to have, and not just Juul products. When you start thinking about these disposable products, that once they're gone, once they've used X amount of puffs, then where does that go? That goes in the trash. But really, nicotine is a poison. And so once that poison has been in these products, it actually becomes a hazardous waste. And there is no good way to get rid of hazardous waste. Juul went on national TV, I think it was CNBC, and said they don't know what the long-term health effects might be of their product. They also apologized to parents for addicting their kids. We never meant to do that. We're really sorry, I'm sure, right? They meant to do it. We'll talk about that in a couple slides. But I also want to point out party mode, because they say they don't market to kids. Party mode is not in any of Juul's instructions, okay? But kids know what party mode is, and adults, for the most part, don't know what party mode is. So party mode is when you hit your Juul. So again, I'm using some vernacular that you might not know. So hitting is taking a puff on your vaping device. So when you hit your Juul, then you can shake your Juul, and it actually makes the charging light flash, and that's called party mode. The only way you would know about that is through social media. Okay, so they market to kids, and they market secretly to kids, which is even more, we should question it more than ever, right? So why is big tobacco so obsessed with hooking teens? Okay, so I was just presenting in a classroom to 11th and 12th graders, and I had a student say to me, after I talked about my last slide, I had a student say, well, I mean, did they really market to kids? I mean, you can say that, but was it really to kids? Yes, it was. And I went to this slide and I said their internal documents were confiscated by the federal government. They were taken to federal court. And those documents revealed that Juul targeted kids as young as 8 years old. They used a really super sophisticated marketing program that went into summer camps, school programs, had hundreds of social media influencers, and those summer camps and school programs were not targeted to the summer camps and school programs for rich kids. Okay, they were targeted to kids who were in the lower socioeconomic summer camps for at-risk kids, that type of thing. They were very strategic in who they targeted and how they did it. So we have safety concerns, lots of them, in regard to vaping. So poisoning, nicotine is a poison. So you can ingest too much, you can inhale too much, and you can absorb too much through your skin. So we've seen toddlers have nicotine poisoning. We've seen poison control calls go through the roof in the last few years. Pets chew up vaping supplies, pods, that type of thing, and ultimately pass away from their nicotine poisoning. So it's a very real thing. Health, as far as addiction, vaping related lung injury, And then we're also starting to see some studies being done on how vaping and nicotine usage and depression and anxiety seem to go hand in hand. And I have a very soft spot for mental health, and I'm going to watch that very closely because I do think there's a link, and I don't know that we've uncovered what the actual link is, but we do know that nicotine affects the brain. So we're going to keep on watching for that link and see what else comes of that. Explosions, there have been multiple reports of explosions across the US. And then labeling of these products. Okay, so the labeling is completely unregulated. They're inaccurate because they're unregulated. And there's no standards for these companies to follow. And so I was at a conference in Washington, D.C., and a VP of Juul stood up and said, we would like some standards to follow. And I'm thinking, yeah, right. Of course you do, because you're the only ones who would be able to afford if they actually put standards in place at this point. But they're unregulated, and you can look at a vaping disposable device and it can say X% of nicotine, it can say milligrams of nicotine, and you have no idea if that is actually what is in there or not. Okay, so we've got a lot of safety concerns when it comes to vaping. So nicotine and brain development. So we talk a lot when I go in and talk to kids, I talk a lot about your brain, how it develops, and that it's developing until at least age 25. Males, it's 27. Nicotine actually changes how your brain is formed. The prefrontal cortex, teachers, school resource officers, parents, we can all see these changes happening. The attention and learning, your decision making, your mood, your permanent lowering of impulse control. That's all affected when you start using nicotine. And how I explain it to kids is nicotine can change your brain so much that you will never be the same person you would have been if you had never started using this product in the first place. And then I also like to point out that nicotine does prime your brain for future addictions of other things. And I think that can be seen, especially in our schools right now. So we're really seeing a high middle school usage. So 6th, 7th, and 8th graders using these products. So they start using nicotine when they're 11, 12, 13. And then what we are now seeing, because it's been here long enough for us to see this, is this movement into using other products when they reach high school. And so our school resource officers talk about how they cite them for nicotine, but it could be something else. And when they get to my nicotine class and we find out, yes, it is something else, we're seeing a lot of hash oil, dab pens, that type of thing. Okay, so when you are priming your brain, getting it ready for addiction, and nicotine changes it in that way, it just makes other addictions that much happen that much quicker. Nicotine poisoning. Okay, so I already had mentioned nicotine poisoning as far as like toddlers and pets go. Nicotine poisoning symptoms can also happen with people who are just vaping too much. And youth, of course, have come up with a term for nicotine poisoning that doesn't sound quite so terrible. So nic sick. If you sit in a room of young people and ask them, have you ever been nic sick? If they're regular vapors, they have been nic sick. And they talk about the symptoms that they've had, and I'm not going to read them all to you guys, but they talk about these symptoms that they've had and how they really make you feel like, holy cow, I can't do this anymore. I'm going to have to stop. But then they're right back to it. And then we talk about, well, what does that actually mean? And what is that? And that is actually nicotine addiction. And they know that. I mean, once you start talking about how you come back to it, even though you feel terrible, even though if it causes all these terrible things in you, if you use it too much, they realize that it's an addiction and that it typically is happening very quickly. So how does the tobacco industry target our youth specifically? So they target them with product placement. which is very self-explanatory. They put it next to products that kids are using. Right now we're seeing, we're seeing it more so in the flavors and package design. So really flavors is a huge one for how they're targeting our youth. When you talk to kids about, when I always ask kids, what are some flavors that you feel are really youth specific? And they say things like cotton candy, bubble gum, and they name all sorts of fruit. And you'll hear the tobacco industry say, well, adults enjoy strawberry too. Adults enjoy banana, watermelon, blah, blah, blah too. But when I go in and I talk, in my opinion, if I go in and I talk to 7th graders and they say they feel targeted with strawberry flavor, or they feel targeted with whatever fruit flavor it is, then that's what's happening. Because if they feel targeted, they're targeted, okay? So we're seeing this massive amount of flavors. I have just purchased a few new disposable devices, and one that I purchased was a double flavor disposable device that you can flip back and forth, and one is mint and one is Fruity Pebbles. So I mean, we're even still seeing the kids cereal, which I thought for sure. I mean, I talked about fruity cereal and kid flavored cereal right at the beginning of this vaping thing, right? I talked about it, and that was the example that I gave. And so I went into a tobacco shop thinking that doesn't happen anymore. And here it is. It's like, Fruity Pebbles, are you kidding me? So we have all these flavors. Then we have advertising and packaging. So this hot pink ad is one of the very first Juul ads that was ever utilized. It was an entire campaign. And you know, Juul says they didn't market to kids, which is a lie. We know that. So their advertising was a huge ploy. And then video games, movies, TV, and social media. When I talk to youth about their social media usage, nearly 100% of them have seen someone vape or seen someone try and sell a vape on their social media accounts, whether it's Instagram or Snapchat, TikTok, all of that. And so we really need to start paying attention to that as well, because the vaping industry knows this, and they don't pay anything for that, okay? And that makes me so angry. Like, they should have to pay for their marketing. They should have to pay for targeting kids, right? They should have to do something, but they somehow get their product into kids' hands using flavors typically, and then the kids are the ones who are pushing it through social media. We are seeing younger and younger kids start vaping. And so I ask the older kids when I speak to them, I ask them to please stop. If it's them trying to sell their vape on social media or vaping and showing the cool smoke tricks and that type of thing, I ask them to please stop, because it is starting to addict 5th graders and 4th graders and 1st graders. Like, I know someone across the state has some 1st graders who got caught vaping on the playground at recess. Okay, those are not words that should be going together in a sentence, but here we are. And so we have to figure out a way to reach those young kids before their social media does. And this is Juul's Vaporized launch campaign. It launched in 2015. You know, this is the campaign that they say didn't target kids, and I beg to differ. Okay, very bright colors. So flavors, I like to really hit flavors a lot. I don't talk about what's happening federally with menthol right now, because I don't know if anybody truly knows what's happening federally with menthol, and we'll have to wait and see what happens. But the flavors are very appealing and youth focused. And so I pulled this product on the right that's it's called Cherry Lime. It's a Loon Max. Okay, that's a vape. I have an example of that here right next to me. I pulled this flavor, this screenshot, because it's cherry lime soda. And in my mind, I'm like, oh my gosh, that sounds so good. Okay, it's 100 degrees outside and I could go for a cherry lime soda right now. You know, and so that's what they're doing. They're coming up with these flavors that just sound so good. And really, honestly, some of them smell really good. Okay, so blue raz lemon slushy, delicious. That sounds fantastic. Iced mango. And what I shared during the buzz session, one of the buzz sessions, was they really seem to like to add the word ice or iced to flavors at the moment. So iced mango, blueberry ice, banana ice. We hear a lot of that for whatever reason. The national flavor ban went into effect last February. It only applies to pod-based systems, which is why we're seeing this massive rise in disposable products. And really, I am for a flavor ban, but it needs to be a complete flavor ban. It can't just be specific products that actually, in my opinion, it has made it worse because we have all sorts of new flavors that hit the market because of this with the disposable products. We also need to start paying attention to online marketing because there are things happening right under our nose that we don't even realize. Okay, so like for example, they'll do like one of these like codes or whatever. So you can get the free AirPod wrap, and hey, those look cool. Like I kind of want that purple AirPod wrap. So should I purchase these e-liquids or some salts, and then I can get that free? I mean, why not? Why not? If I'm gonna vape anyway, why wouldn't I order from this place and get a new AirPod wrap? I mean, it's brilliant marketing. It's also quite pitiful marketing. And then I took a screenshot of this one because I think it's important to remember that we are going to see a movement away from nicotine products and to different oil vaporizers. And they're careful about how they say things on this. But really what we're seeing in high schools is a more the THC type products that are going to have a bigger bang. I mean, that is really what we're seeing. Our school resource officers, at least here in Fargo, are saying that that's what they're seeing. A movement away from nicotine vaping and movement towards anything else. So my kid doesn't do this, does he? Well, 1 in 5 high school students used a vape in 2018, according to the CDC. 33% of North Dakota high schoolers, according to our 2019 Youth Risk Behavior Survey. They're seeing it in school bathrooms, right in class, on the bus, in the halls, anywhere really, okay? And we have to remind ourselves that these kids are becoming addicted very quickly. And I think that's why we're seeing it happen in classrooms. And you know, we have kids who come to our tobacco education class who they get up in the middle of the night and they hit their vape because their withdrawal symptoms are waking them up. And I would have to say, so I have not seen as an addiction, and I go back and forth because there are certain kids who are like, no, I'm not addicted. But when they talk about how much they're vaping, and their side effects when they don't, they're addicted. They just haven't realized that yet. These products are extremely easy to conceal, and that's how they're marketed, especially online. Social media, again, a huge problem. Okay, social media can be used for good. In the vaping world, it's terrible. We see vaping as a gateway to other drugs, which I have mentioned. And it's also starting to re-normalize smoking. So we're seeing kids who would never have picked up a cigarette, they are starting to smoke. So we have lots and lots of issues when it comes to vaping. So when we ask kids, why do you use tobacco or vape products? A lot of times they say these things. And I would say nearly 100% of them talk about their anxiety and their stress. And I think that's really a sad situation that we're in here in our country. You know, anxiety is a huge, huge issue. Kids feel stressed and they shouldn't feel stressed. Not to this point anyway, where they feel like they have to use a product in order to help them with that. So how are kids getting it? Okay, so common ways, social media, websites, those age things are easy to bypass. And kids are using their parents' names for shipping. Clerks at tobacco shops and vape shops and gas stations, they might not enforce the law. We have compliance checks across the state to try and avoid that as much as possible. A lot of vape companies don't have names that would raise a red flag on a parent's credit card statement. And then I don't know about Amazon lockers here. I don't know. I know there are a couple here in town, but I don't know across the state of North Dakota how many of those there are. And then orders, especially during COVID, could also be shipped to homes when mom and dad weren't there. So there was a lot less eyes on kids over the last year. And then we have over on the left, okay, so this hide device, I find it intriguing that it's called hide. In my mind, it's called hide because it hides right in plain sight. You don't even know what you're looking at. There is no distinguishing features on that thing. All of the information that you would need, the warning label, it's on the box, it's not on the product. And then these skins that they're coming up with. Okay, so we've got a Fortnite skin there on that Thorson drop. That's a refillable device down there on the bottom. In the news, so we've had vaping related lung injury, or EVALI. It's called e-cigarette or vaping product use associated lung injury. I call it vaping related lung injury. The CDC quit reporting on it last February due to obvious reasons. 2,800 cases nationwide is how many they had confirmed, 68 deaths, 29 states. Most of those cases, patients did report using THC containing products or vitamin E acetate was also linked into that. However, so the black market products really, like, they came under fire. Like, you're buying it on the black market. But I think I want to remind people that these products are not, they're not FDA, like, there's nothing that they have to follow. And so what constitutes black market? Like, what is it the guy selling it in the back alley, so that's black market? Or is it because they are not regulated and so no one really knows what's in any of them? Is that black market? We don't really, like, you know what I mean? We don't really know. And so here at Fargo Cast, we've kind of taken this stance of, please don't vape, even if you're of age. We would like to help you quit in other ways because we know what's approved and we know what can help you. So anyway, so we've had that vaping related lung injury. We had students here in Fargo be hospitalized with it, that type of thing. Tobacco 21 passed federally. President Trump signed that into law December 20th of 2019. We like it. We want Tobacco 21. It raised the legal age to purchase tobacco products from 18 to 21. Just through our North Dakota legislative session, Governor Burleigh signed T21 into law right at the end of March, which is fantastic. And now local public health units will work to get North Dakota law into our local ordinances. Once they're in local ordinance, if some of us also have compliance checks written into our grant and into our ordinance, and so we do compliance checks. Once that T21 gets passed into local ordinance, then we'll be able to compliance check to age 21, which will be great. I just want to throw out there that teens who vape are 5 times more likely to get COVID than teens who don't. Why is that? So we talk about, and I talk about this with students too, smoking or vaping cannabis or tobacco. It does two things. It damages your lungs and it harms your immune system. And if your immune system is harmed, that makes your body less able to fight diseases, which, you know, we've learned all these new words in the last year, right? So if you're a close contact to someone who tests positive for COVID, then you are more likely to get it because your body can't fight that disease. We have a youth quit line, a youth texting quit line here in North Dakota called My Life, My Quit. When I talk to kids who have been in trouble for vaping, we talk about what would make you want to quit or not use again. And a lot of times something scary has to happen to them or a sibling. Sometimes a parent, but a lot of times they say something has to happen to like me or my brother or sister. And so if they're to that point, I think getting teens to this point of actually wanting to quit is one of the most challenging things there is, because we don't know long-term health effects. So with cigarettes, you stink, okay? They don't want to smell, so they also know how bad smoking is for them. We know the long-term health effects. We don't know long-term health effects officially because they haven't been around long enough for us to know those long-term health effects. So specifically, what are you looking for as an adult with maybe you're sitting here listening to this thinking, oh my gosh, when I get home, I am going to be looking for these products in my teenager's backpack because school's done now. So we want you to be looking for changes in your kids' behavior, like increased mood swings, irritability, anxiety, impulsivity. And a lot of times we say, well, it looks like, okay, great, Melissa, but that is teenagers. Okay, mood swings, irritability, anxiety, like that's teenagers. We're not talking about the normal stuff, okay? We're talking about like really changes. I know someone who lives near me who I guess he was vaping before his mom did because his personality changed so drastically. So just be on the lookout for things like that where it's like, what in the world? What happened here? Are your kids suffering from more frequent headaches or nausea? Do they not feel good? Are there sweet or fruity smells coming from behind places where there shouldn't be fruity or sweet smells coming from? I remember when I first started presenting on vaping 7 years ago, and I was presenting to some teachers, and a teacher said, oh my gosh, they're vaping in the back hallway. And he goes, it always smells like cereal back there and no one's ever eating anything. So you got to be on the lookout for weird smells that shouldn't be there. Okay. We're also wanting you to look for vials or eyedropper bottles, weird chargers or weird batteries that you don't recognize and you didn't buy the device that would charge. Okay. Weird terminology that you have never heard before or seems really out of place. If you hear someone say, oh yeah, I zeroed out, they're vaping. Okay, vaping, they're holding that, when they inhale, they're holding that in their mouth. And zeroing out is they hold it in their mouth long enough that when they exhale, there is no cloud, there is no vaping plume that is exhaled. Okay, that's zeroing out. We might hear a student say, I lost my pen, can I borrow yours? At school. So when we talk to teachers, we're like, if you hear someone say, can I borrow your book? Or I lost my pen, can I borrow yours? They are more than likely not talking about books and pens. Okay. They are more than likely talking about a vape. And then referencing people's names that you don't know. Like, so I've had students come to my class and say they name their vapes because then their parents have no clue what they're talking about. Teachers don't know who they're talking about. So these products, North Dakota tobacco tax rates for 2021, the cigarette tax is 44 cents. We are 49th in the nation, so extremely low. I think the big problem with vaping is that there is no tobacco tax on vape products. And that's a huge problem. Okay, we need to raise the price of these products. I went into a tobacco shop to get some of these new products, and they were having a sale and all disposable products, didn't matter how many puffs. So I bought a couple that were like 2,500 puffs, like thousands of puffs, for $10 a piece. Okay, that's an issue. So we know that raising the price of tobacco is a CDC best practice. And what does that mean? That means it's proven to lower tobacco usage rates. It increases the number of people quitting. It lowers the number of young people starting. So we have to make that change. And then what can you do? So we talked to our students about what can you do. So what have you learned in this presentation that makes you fired up and mad like I am, and want to help do something? So here at Fargo CAS, we have our Tobacco Prevention and Cessation Coalition. I encourage you, if you live across the state, to contact your local public health unit. If you're not working with public health, contact them, see what their coalition looks like. Assist in creating a tobacco prevention coalition at your school. So that's what we're talking about when we're really pushing tobacco prevention in our schools right now. So we're encouraging kids to do that as much as possible. Please know that we have a Break Free Youth Action Summit that happens every fall. We have one in Bismarck and one in Fargo. We plan them in tandem. We plan them with each other. It's the same exact summit, just one day in Fargo, one day in Bismarck. And those are for youth, and where we encourage or we educate youth on how to take action. And it's really important, and I think it's a really cool learning experience for those people. Writing letters to your editor about tobacco policy you'd like to see changed, and then talking to your legislators and city commissioners is incredibly important. So with that is that of my presentation. So I'm coming back. So does anybody have any questions? Let's see. Easily have my students have vaped. Is it still common to smell fruity flavors walking in the class? Morning buzz. I would say that morning buzz, I would say yes, because it's just like a cigarette. You know, if you talk to a cigarette user, smoker, they will say that the most, like, their favorite cigarette is that first one in the morning because they haven't smoked all night long. And so they are really in withdrawal. They might feel really jittery. They really need it. And when they take that first hit, it just calms all that down. And so, yes, I would say that morning buzz is very important to students, to probably everyone who's vaping, but yes, students especially. Any other questions? So I am going to turn my camera on and just attempt, we'll attempt this and hopefully it doesn't lock up, but I do want to show you just some of these newer products that we are seeing and the size of them. So this is the hide that I had on my, that I had on the PowerPoint. And I mean, if you can see it fits right in the palm of your hand. It's not that big, okay? There is nothing really distinguishing about this particular product. It smells, it has a smell to it, but it's not a bad smell, okay? So you're looking for products like that. You might be looking for products like this. This is the Loon Max. It is berry lemon bubble gum. So very much a flavor that kids are interested in. Again, not very big. They're all about this size right now. The disposable products are all about this size. And then the Loon Air. So this is the box that it comes in. Okay, this is, I bought this flavor. It's called Bad Bull, to taste like Red Bull, right? So when I went into the tobacco shop, I asked a younger person who is there purchasing, I said, what flavor would you buy if you were buying this Loon Air? And she said, I'd buy the Red Bull. And I just found it interesting because it's not called Red Bull, it's called Bad Bull, but she replaces it with a product that she knows based on what is on the, what it looks like, right? So this is the Loon Air, and I wanted to show you this one as well because it is also very small, fits in the palm of your hand, very thin. So these are the type of products that we're seeing. Once they're gone, you toss them in the trash. This one in particular has 800 plus puffs. So that is what we are dealing with. So yes, I thank you all for attending, and we will be discussing more in the next intensive 1B right after this. I think there's a little break, and then we'll be discussing. So there'll be myself from Fargo Cass and Haley Thorson from Grand and Jordyn Schaefbauer from Bismarck Burleigh.
And I'm just going to jump in here as the moderator because we do still have some more time for questions. And there is one question here in the Q&A. What are your thoughts on the new legislation passed to increase the minimum sales age to 21? And I think you touched on that a little bit, but do you want to add anything further to that?
So raising the age to 21 it's proven to cut down on kids vaping. You know, really I like it. We wanted it to pass here. I was happy to see that it did. We need to keep it out of the hands of kids as much as possible. And when 18-year-olds can purchase, 18-year-olds are in high school. So I was 18 right at the beginning of my senior year. So I could have purchased tobacco my entire senior year. And that's what we're seeing is these older brothers and purchasing for younger people who they know, friends that they know. When you raise the age to purchase, it gets harder, or it should get harder, because you should be, your tobacco places should be carding to 21. And typically 21-year-olds aren't hanging out with, hopefully, aren't hanging out with the 15-year-olds and the 15-year-olds, right? 21-year-olds they're moving on. Okay, 18-year-olds are still in that. They might be riding the bus with the 14-year-olds, you know? So, so yes, we, you know, in tobacco prevention, we like solid policy, and tobacco 21 is good policy. You know, the flavor ban, not such great policy. It needs some work.
Do we have any other questions or comments? You go ahead with that as well. We're doing really well time-wise, so we definitely have time if you guys do want to share anything or ask anything.
Okay, so what would my response be to a teen that says smoking cigarettes is gross, but vaping's okay? That's what they all say. That's all of the kids who come to my tobacco education class have been cited for using or possessing tobacco here in Fargo. That's what they say. I mean, it's been a long time since I've had a student actually smoke cigarettes, because the overall feeling is that smoking is gross. And a lot of people do feel like vaping is okay. To that, I would say, how do you know that? What makes vaping okay for you? What makes, because during our classes, we all, well, it's okay for 5th graders to be vaping on the playground, because that's what we're seeing. We're seeing, okay. And overwhelmingly, they say, no, 5th graders should not be using. And then I say, well, should 7th graders be using? Because half the class is 7th graders. No, they shouldn't be using either. And then, I mean, so when you start talking about, what makes it okay, thinking about, I can't tell teenagers a whole lot. And so I think just getting them to think about what's the difference? Why is vaping okay? and smoking isn't. And, you know, I also like to talk to them about, like, does it make you look cool? Would you date someone who vapes? Would you date someone who smokes? And it is very different. They wouldn't date people who smoke for the most part. They say, oh, nope, I'm not having any of that. But they will date someone who vapes because, well, you know, they're just doing them, that, you know, you do you. And it's like, whoa. So how do you, it's a good question. We just try and hit them with as much education as we can that is pertinent to making them think like, oh, maybe it isn't okay. What program do I use for my tobacco education class? I don't use a program, Barb. It's very similar to the PowerPoint you just saw, except we do a lot more discussion about what they're using, why they started using it, how much they're using. We do a lot of discussion. We are looking at potentially changing our city ordinance to require it, not as a class, but tobacco cessation consultation instead. So they'd be meeting one-on-one with me instead of doing a class. We're finding that the huge age difference in these kids getting these citations is making tobacco education class really challenging. You said those that vape, they hit it. Is that the most common term? Yeah, okay, so yes, so hit is the most common, I would say. When Haley and Jordyn get back on in a little bit, they might say other things, but I hear youth say they hit it all the time. A rip, yes, but I would say a rip was probably more utilized and is more utilized when they're using the big tanks and mods that have to be recharged and refilled. I would say that would be more of the RIP terminology. Thank you, Jordyn. No, yeah, Jordyn just uploaded some lingo. Thank you.
I would just say that the hit term as well is so concerning because that's so linked to harder drugs as well. And I do also want to highlight that there is a question in the Q&A.
Oh, okay.
Could you explain why the flavor ban is bad policy?
Well, I feel it's bad policy because I feel like it has created I feel like it's created just this like gateway right into disposable products because disposable products don't have any kind of flavor ban at all. And so, you know, that flavor ban, it's just pod-based systems. It doesn't pertain to menthol. And so there's just there's way too much still available on the market. And I actually think it's caused an explosion of additional flavors being able to be purchased, especially like, okay, so for example, like this disposable product, okay, this is actually a 2-in-1 flavor disposable product. So we don't see 2-in-1 pod-based systems, but we see 2-in-1 disposables. So this one's actually mint and fruity pebbles. And if you get sick of vaping mint, then there's a little switch at the bottom. You just flip it and now you're vaping fruity pebbles. So, you know, we didn't have these types of things before the pod, you know, so I think there's just been a huge, I don't know, it's just really grown in the past. And I feel like because of COVID and everybody kind of went away, went home for a while and nobody was really paying attention, kind of got this false sense of it's okay now, it's good, and it's worse than it's ever been. So any other questions? And I will say that if you have presentations that you would like done locally, just contact your local public health units or Tobacco Free North Dakota, and any one of us would be happy to do presentations for you. We do school presentations and school resource officers and teachers and civic groups and every parents, anybody in between.
So it says if there is a complete if there is a complete flavor ban and vapes smelt like cigarettes, would you think we would see a decrease in vaping?
I do. I think we would see a decrease in kids starting. We are going to have this problem is going to be on our hands for a long time because we have an entire generation of youth addicted to nicotine. You can't just shut off a nicotine addiction. And so, so yes, I think it would slow the start, but we're still going to have to figure out what we're going to do with these youth who are addicted to nicotine right now.
So first of all, we have Melissa Markegard. Melissa works as a tobacco prevention coordinator at Fargo Public Health. She received her undergraduate degree from Minnesota State University Moorhead in community health education and her master's degree from North Dakota State University in emergency management. As a tobacco coordinator, she works as a certified tobacco treatment specialist through the Mayo Clinic, helping her clients quit when they are ready. She also works with all of the school resource officers in Cass County within the school, conducting trainings with teachers and students on e-cigarettes and their dangers. Tobacco prevention has changed significantly in the last 2 years with the introduction of e-cigarettes, especially with the Juul and other easy to conceal devices. Due to those rapid changes, many things in tobacco prevention have changed as well. Melissa works continuously to get the message out via media outlets, social media, and presentations in Cass County. Jordyn Schaefbauer is another one of our presenters, and she graduated in 2014 from North Dakota State University with a degree in health education. After graduating college, she started her career as a tobacco prevention specialist with Bismarck Burleigh Public Health's Tobacco Prevention and Control Program. Jordyn works with youth and young adults in Bismarck and Burleigh County, educating about the dangers of the latest tobacco products and helps young people to develop their skills as youth advocates in the community. Over the last few years, Jordyn has worked with other tobacco prevention coordinators from across North Dakota, helping them to include youth in their own local policy and advocacy work. When not at work, Jordyn teaches yoga, spends time with her dogs, and loves to hike and watch movies with her husband. And lastly, Haley Thorson has been with Grand Forks Public Health's tobacco prevention for over 14 years. She started there shortly after completing her BS in nursing at the University of North Dakota in 2005. Haley is the chairperson of the Grand Forks Tobacco Free Coalition and takes pride in facilitating advocacy and tobacco prevention efforts, especially policy, including the first youth access ordinance in the state addressing electronic products in 2014 to one of the most comprehensive tobacco-free parks policies across North Dakota. Haley has a passion for helping others understand the long-lasting impacts of policy, system, and environmental change. As for disclosures, the presenter indicated that this presentation will not include discussion of any commercial products or services and will not include any discussion of off-label or investigational use of any products or services. It will include trade names to educate on the different vaping devices being seen locally and nationally. That's what I have for the intro, so I will turn it over to our presenters. And just a heads up for everyone here, this is definitely more of a panel deal. They will give you some information in general, but we have lots of time for questions. So if you want to start posting any questions you have to the Q&A, you sure can do that, so that then we have those ready to go when the time comes.
Okay, Joni, I think what I'm going to do, just to maybe avoid any technical difficulties, is just leave my camera off, if that's okay. I don't have slides to share. As Joni mentioned, my name is Haley Thorson, and I'm from Grand Forks Public Health. And thank you for joining us for Intensive 1B. Welcome back if you attended either the vaping and juuling buzz sessions this morning and or the first half of the intensive that Melissa presented this afternoon. During this session, we're going to provide a little more insight into some of the strategies that we're using across the state to address some of the issues, as well as the usage trends that we learned about from either the buzz sessions or from Melissa's session. So I would like to thank NDPHA and the Center for Rural Health for organizing another year of the Dakota Conference, and we're glad to be here in virtual land with you today. The three of us presenters were actually prepared to present to you last summer. So as you can imagine, and as Melissa said, these products and their associated consequences and policies proliferate so rapidly that we already have had to modify our content. So I'd like to start off with some of the strategies we consider best practices, and Melissa mentioned best practices earlier as well. But we use these in terms of preventing and reducing tobacco use, and we here in North Dakota include vaping in that realm. Even though these products are newer, we do rely heavily on the fundamentals. And so our most recent CDC best practice guidance document was updated in 2014. And that was really right on the onset of the vaping epidemic. We did have some products here in the country prior to that, but some of the ones that we're really focusing on now were coming on the scene right about 2014. And even more so like the ones that Melissa presented on and showed us, like she said, really within the last few years. So while vaping products and devices aren't specifically mentioned in most of the recent CDC update, we want to just kind of give a shout out to the North Dakota Department of Health and the brave stance that our state tobacco prevention leadership have on vaping products, because we do treat them as tobacco products here in North Dakota, and that's not really true everywhere. And so we apply the same goals and strategies to these products just like we would cigarettes or chewing tobacco. For example, some other states, entities, and partners are more readily studying the possibility of harms reduction in relation to electronic products. And we've chosen to wait for science on that before we treat them as anything even remotely close to a cessation product or a harm reduction product. So Melissa kind of alluded to that earlier too, but because we feel like our product has stood by that stance, we refer and defer back to best practices on tobacco when we talk about how we are going to address the vaping problem. So CDC encourages a comprehensive application of strategies, and it's really a mix, and there's really 5 main areas that they want us to be focusing on. I keep referring back to Melissa because I've been with Melissa most of the day today, but we've heard words like policy, and for most of us that have been in tobacco prevention for a long time know that policy is really where we get the bang for our buck. And in many of these 5 different areas, there are pieces of policy. So the first area being regulatory, that would be something like the flavor ban or licensing policies. The second area being social, which would be more like our tobacco-free policies that help create social norms where tobacco use is unacceptable. The third strategy area is educational, and this is much of what Melissa and Jordyn will talk about. Basically, it's our media and what is our message and how do we distribute that message to either the public or whatever audience that we're talking to. The fourth strategy area is clinical, and that would be where we would put something like our cessation interventions. And then the fifth area is economic, and that is where we would place something like the price increase of tobacco products. So just briefly to expand on each of those, when we're talking about regulatory strategies, the 2009 Tobacco Control Act finally gave the FDA authority to regulate tobacco products and that explicitly included traditional tobacco products like cigarettes and smokeless tobacco, but it also gave them the authority to deem future products as tobacco products. So we went from 2009 all the way till 2016 when the FDA officially deemed electronic nicotine products as tobacco products for regulation. And so what that means is that from the time these products came on the scene in the early 2000s to 2016, minors were legally able to purchase these products at the retail level. So in the city of Grand Forks, we did pass a local ordinance in 2014 to define electronic products as tobacco products, so they would fall under the purview of the legal purchase age law, and that was 18 at the time. And then we also included, because we defined them as tobacco products, included them in the requirement for local licensing at that time. And that way we were able to do local compliance checks to be conducted in locations that only sold electronic devices. And so there were some areas that sold both traditional tobacco products and electronic products, and they had always been getting compliance checks, but now at that time we were able to look at some of those stores that were selling some of these electronic products. And then since the deeming rule in 2016, our statewide advocates have been attempting to implement statewide legislation that would define electronic products as tobacco products, and that would allow for the licensing across the whole state. And we've tried and tried, haven't gotten there quite yet, but it's not for lack of effort. But mostly due to tobacco industry influence that these products that they want them to be considered harms reduction. And so that's kind of the big pull at the state. But that is one of our big areas that we're trying to accomplish statewide. We did have legislative success, though, and this was referred to in the previous session with the passage of our T21 federal alignment bill. And so I'll kind of just briefly describe that again in case you weren't with us for the first half of the session. But the federal minimum legal sales age was increased from 18 to 21 in December 2019. And this included electronic nicotine products. And then the North Dakota legislature just adopted similar requirements with an emergency clause. So that was basically effective as soon as the governor signed the bill. And if we adopt these policies like T21 at the local level, it will allow for local enforcement of the minimum legal sales age law. And I think Melissa mentioned this too, but data does support or show that youth report getting the vaping devices from older peers. So increasing the legal age will hopefully make it more clear who should not be using these devices, even though we don't want anyone using them. If someone is very young looking, it would be more clear that they aren't of legal age. And then another regulatory strategy that occurred at the federal level was the restriction on flavors, but that only was on the pod-based systems. And so Melissa kind of pointed out that it really left open a very large loophole for companies to build products that would easily kind of skirt that. And so while it was good, we are always one step behind the tobacco companies when it comes to some of these bigger federal policies. So we can look at state and local flavor restriction policies, and that's always consistently at the top of our list. But we know that the tobacco companies are very aware that by reducing flavors, we would make a big dent in the use rates. And so that's one of the biggest areas that they lobby against policies as such. The other thing too that I thought of earlier when Melissa was showing some of the packaging is that 2016 deeming rule also had several provisions that have been delayed. Everything comes with bureaucratic red tape. But there are some pieces like marketing and advertising restrictions that should be imposed on these products that would not allow them to mimic other non-tobacco products or, for instance, support or whatnot, like a NASCAR sponsorship. So those can now legally happen because those rules have not yet become effective. And yes, we are 5 years out from 2016. And so it just goes to show how much time and money and pull the tobacco industry has to kind of delay some of these policies that we know will be extremely effective. Social strategies is kind of where we get to like rest our hat a little bit. The North Dakota statewide smoke-free law really got a jump start on social strategies because we included electronic products in our statewide smoke-free law, and it really was, I believe, the first in the nation to include electronic products in a smoke-free law. And what that did was just kind of, it was like a momentum to incorporate electronic products in other policies, such as tobacco-free schools, parks, other public places and workplaces. And while it seems small, it really does result in decreased exposure to product use, particularly among youth, because we know that that's when they're most impressionable, but also it increased the opportunities for education. So if you pass a new policy, you generally have to educate about it. And it kind of just, it helped create more possibilities for that type of education. And then speaking of education, and this is where, like I said, Jordyn and Melissa will have a little bit more detail about what's going on currently. But education is really where it's at, especially when you're talking about something that is so new and everybody wants to know about it. So there's mass media and there's, the traditional grassroots community education. And I just want to highlight that the vaping epidemic worsened while the products simultaneously proliferated and the requests for more information increased. So when we saw those rates going up, and then all of a sudden you have all these new products that we could barely keep up with, kind of at that same time, that's when EVALI started happening. That was summer 2019. And we were getting requests for presentations from all sorts of audiences. And for those that weren't with us for the first half, EVALI is the electronic and vaping associated lung injuries. And so basically we started seeing this outbreak. And if we can, think of the last 16 months, this was our COVID of 2019 really. And so it exploded in terms of the requests for audiences seeking information on vaping. And we had to make sure that we were as up to date as we could be, so that we could share the information, and then those folks could share information with others. And so anywhere from audiences to policymakers, healthcare providers, parents, schools, we had to enlist help from our community partners. And so we had a lot of partner coalitions, different school entities like substance abuse prevention coordinators at schools, and some of our youth groups in town that were actually stepping up to the plate and helping us share the message on vaping. And so I'll just leave educational strategies at that, because I know Jordyn and Melissa will talk a little bit more there. We do have clinical strategies in terms of vaping reduction, and we are lucky in North Dakota to have a state organized cessation effort that offers services to all ages, and that includes for those that use electronic nicotine products. So ND Quits will serve youth as young as 14 who need assistance, but the My Life, My Quit program is tailored specifically for teens, and it's easy to find if you just Google mylifemyquit.com. That website not only has a portal for cessation access for youth, but there are tons of information and resources on that site. So if you're looking specifically for something to share with people, I would definitely give them that website, because there is a plethora of information there. And the last strategy that I mentioned was economics. And Melissa briefly touched on this too, but it just wouldn't be a tobacco presentation from Haley Thorson if we didn't include our little bitty on increasing the tobacco tax. So last but certainly not least, one of the most effective ways to reduce tobacco use is to increase the price. We have levied the last several sessions to increase the price of tobacco at the legislature, including implementing it on electronic products. And we haven't been successful yet, but because electronic products are not defined in state code as tobacco products, they are not taxed at all as tobacco products. And again, back to tobacco companies, they know that this strategy works because it has worked on other products in the past. They spend a lot of time and a lot of money talking with our policymakers on why it's a bad idea to even consider taxing vaping products, because they kind of go back to that thought of these could be a harms reduction tool, and if we start taxing them, then people won't switch to them and become healthier. So that's kind of the mantra there with economical strategies. So we will continue to fight the good fight on increasing tobacco tax, including vaping products. So that was a lot of verbiage on those 5 areas that we consider best practices. We continue to chip away at all of those. Very high level overview, but if you have questions on any of these, please don't hesitate to put it in the room specific chat or contact me via the information found in the conference attendee list. And so now I will turn it over to Jordyn, and she is going to describe how she's engaged youth and address comprehensive strategies on vaping.
My name is Jordyn Schaefbauer, and I am the tobacco prevention specialist here at Bismarck Burleigh Public Health Faculties. So my name is Jordyn Schaefbauer, like I said, and I do the tobacco prevention, the youth portion of the work here in Bismarck, North Dakota. And we have Sue Kaler, who does the cessation and more of the adult-focused work and policy here in our office as well. But in terms of youth engagement with tobacco prevention in North Dakota, we kind of go in a lot. It depends on where you're at in the state to know and what everyone is doing. But here in Bismarck, we actually have school tobacco prevention coordinators, and these are individuals that work at the schools full time. And it could be someone who's a teacher, counselor, it could be a staff member, and they are contracted with the schools and us. And we have 8 schools in Bismarck that participate, 4 middle schools and 4 high schools. So we also do public school, and we have our 2 private schools that we contract with as well. We provide these individuals a stipend, for them to do the tobacco prevention work, and then a supply budget for anything they need to do activities. And I'll have pictures of the different kind of activities in just a sec. Excuse me. But what these coordinators do is they actually assist youth in educating their peers within the school. So really a peer-to-peer education. They attend our school faculty tobacco prevention coordinator meetings, and we have 2 every year. So in the beginning of the year, I email the school districts and we get our contract stuff sorted out. And then sometimes I have to have new coordinators come in. Sometimes we have coordinators that have been around for years, which is really great. But it's also really nice when we have new ones to get just a new fresh set of eyes and ears. And so right now the coordinators, knock on wood, going into this coming school year, they're all returning coordinators, but they attend our school coordinator meetings, and that's just with me, and we go over kind of what to expect for the year. If it's a legislative year, there's a lot more engagement going on. They complete progress reports. They're required to participate and attend a minimum of 2 youth-led special projects. And I'll get into that in a sec. And then we also have our Break Free Youth Action Summit, which I will also get into that in a second as well. So youth can be advocates for tobacco prevention by having a SAD group. So when I talk about the school tobacco prevention coordinators, they could be leaders of a SAD chapter. Sometimes they're leaders or they teach HOSA, so like the different health classes in the schools. They might, SAD's kind of going away, at least in our area, but it might be more prevalent in your area. But we work with these people these coordinators and the students to conduct these school and community-wide activism. So you can see that picture that says not a replacement. The students that were part of the tobacco prevention group, which is now known as Break Free, they had these name tags. It was really cool that said, "I'm not a replacement, I'm a," and then students had to fill it out. And so the students that our school tobacco prevention coordinators oversee, they conduct these big activities in their schools. But it doesn't always have to be big activities. They could work with the students to go and testify at a legislative hearing, at a city commission hearing, park board, school board. So we work with the youth to help pass policies that affect them. They might contact legislators throughout the year, speak at a press conference, write a letter to the editor, and youth youth can do this without having a tobacco prevention coordinator in their school too. So if you know a student that's very passionate about this subject, there are tons of ways that they can get involved. This list just being some of them. When these activities take place throughout the year is typically during tobacco prevention holidays, or tobacco-free holidays is kind of what I like to call them. So things like Great American Smokeout, Great American Spit Out, Through with Chew Week, Take Down Tobacco Day, which used to be known as Kick Butts Day, but Campaign for Tobacco-Free Kids actually changed the name to be more all-encompassing, especially including vaping. Because we have a lot of students that typically the groups like to educate on vaping, so educating their peers on the dangers of vaping, or smokeless tobacco. So it kind of varies on what that school is really passionate about and what policies our community is trying to move forward. National Drug and Alcohol Facts Week was a new one that we participated in this year. And that was a really cool event because the National Drug and Alcohol Facts Week people, they actually had pre-put together activities, and World No Tobacco Day as well. But it doesn't have to just be a school-wide activity or activism. And you see on the top right picture, we have students that actually went, and this is right before COVID became a thing in Bismarck. We worked with students to go to the Bismarck City Commission and pass a proclamation to take down Tobacco Day National Day of Action, and have that signed by the Bismarck City Commission. And I think that was the end of March, but it feels like forever ago, but it was right before COVID was really a thing. As you can see, we're not wearing masks. But it was a really cool event, and that's something you can do in your community too with youth, is having your city commission sign a proclamation. And, you know, all these activities, they change throughout the year. Sometimes it's really cool to see the kids take an activity that, or an idea that you give them, and then they kick it up a notch and they change it. So you can see in the bottom right, the little baggie that has a My Life, My Quit card. This is Bismarck High School's project, and they put lifesavers in it. And you can see on there, you know, avoiding nicotine and tobacco use can be a lifesaver. And they handed those out to students in Bismarck High School. So it's really fun to let the kids, you know, take an idea and change it. But where all these ideas come from, oh wait, not yet. That's the ideas, a lot of them come from the Youth Summit, where they get started, which I will talk about in one slide. But one really great resource before I get into the Youth Summit is the Takedown Tobacco training, which is from Campaign for Tobacco-Free Kids. And it's a free, comprehensive youth advocacy training. It has middle and high school students, and they can take courses like Tobacco 101. So really learning the nitty-gritty behind what happened with the history of the tobacco industry, and, you know, the rise of vaping. So they learn about vaping, and they get to also learn about different activisms or advocacy skills as well. And Campaign for Tobacco for Kids is a really great organization that works with youth. And we actually have had students in the past go to their symposium that they hold every summer. And the young lady in the very middle, just above the ing in training, she was actually one of our former students and has actually come back to our office and helped work on our youth summit a couple years ago. And so, you know, these youth that we work with, it's amazing just to see them grow and become more confident in their skills, but also to see where they end up when they go off to college, and if they come back to Bismarck and see their passion still for tobacco prevention and asking to help us on different policy and things like that. So one thing I want to note, Campaign for Tobacco-Free Kids, their virtual advocacy, or their summer advocacy symposium has actually gone virtual this year, and it's open to all students ages 13 to 24. And it's held 3 days from 3 to 5 p.m. Eastern time. But if you have students that, I know it's summer and it might be hard to get in contact with them, but I really encourage sharing this opportunity, and I will go, once I'm done speaking, I'll put the link for this in the chat box so you guys can take a look at it and pass it along to any students. But it's a really awesome opportunity for them to learn how to talk with legislators and learn different advocacy skills from a national organization. So the Youth Summit, this is kind of like our big kit and caboodle for the year in terms of youth advocacy work. And the Bismarck one has been going on for probably about a little over 11 years. But we have since opened it up to be a statewide youth action summit. And we've also branded it, which we're really excited about. So it's the Break Free Youth Action Summit. It is held in Fargo on this year on October 5th, and it will be held on October 6th in Bismarck. And it's the exact same summit. We just do one in Fargo and one in Bismarck to make it easier for the young people to travel in for the hands-on training. And if you scan that QR code on the screen, it will take you to our Youth Action Summit webpage for you to get some more information. But mark your calendars for October 5th for Fargo if you're in that area, and October 6th for Bismarck. We plan on having it as an in-person conference, and we're actually bringing someone in hopefully from California is our plan. And our theme this year is flavored tobacco products, and hopes to do a lot of education for the youth to learn about the dangers of flavored products, how they're marketed to. And then what they do from the summit is they take this information and they bring it back to their schools for that peer-to-peer education during the tobacco-free holidays throughout the year. So highly recommend if you have students that are interested and you want to learn more, check out our webpage, but also talk to your local public health unit because they'll have more information on it as well. And then one other activity event that we've done in the past was we had a day at the Capitol where we brought over 100 students to the Capitol to actually talk with legislators. You can see some of our students having lunch with Representative Clemene on the far right, or on the far left, excuse me. And we have a student that talked at a press conference, but it was a really awesome event that students from all across North Dakota came together at the Capitol during the session in 2019 to meet with their legislators and actually sit down and have lunch with them. The legislators were really great, and it was a lot of fun having them have the opportunity to actually be at the Capitol. And some of the students even got to go sit on the floor with the legislators. So that was a really great opportunity for them. It was fun to see them get engaged in the legislative session and get excited. And hopefully, fingers crossed, it's something we can do again in the future. But yeah, we worked with the tobacco prevention coordinators across the state, TFND, American Cancer Society, and just to throw on this really great event at the Capitol to get youth to take what they learned, not only at the summit, but throughout the year, and take that information and share that information and their story with their legislators. We also have the Break Free statewide youth coalition. So if you have youth that are passionate about tobacco prevention, this is a great statewide youth coalition for them to get involved in. And Break Free, we have a small chapter here in Bismarck, and then little groups of students across the state, but they come together for the statewide youth coalition. And so if you have students that are interested in joining something like that, one, it looks really good on a resume, and two, they get some awesome opportunities. This last year, one of the students on the statewide youth coalition actually she went to the Capitol and testified for the smoke-free law to protect our North Dakota smoke-free law, and then got to go with TFND, Tobacco Free North Dakota, and help with some lobbying on the floor with the legislators. So a really cool opportunity, and that's something that students in your area, if they're interested in, have the opportunity to do. And Abby Erickson, I think I saw you on the training, but here is Abby's contact information if you have youth that are interested in joining the Break Free Statewide Youth Coalition. You can send her an email or reach out to Abby. And I know that's a question slide. I'm going to escape this, and I'm going to turn it over to Melissa.
So I will just jump on then. This is Melissa again, if you attended my session earlier, or the buzz sessions, but I just quickly want to talk about the community education that we do here in Fargo. We do a lot of media, and we have a media campaign that we choose every grant cycle. Currently, we just launched. Because of COVID, everything kind of was held things back, and we had to revamp our messaging last year because it didn't make sense because of COVID. And so anyway, we have a media campaign right now, and called Spot the Signs. And so that particular campaign is geared towards adults and teenagers, and we want them to spot the signs in different ways. Parents, we want them to be able to spot the signs of use in their teenagers or their students or the kids that they coach, all of that. So messaging around how to actually spot those signs. And then for teens, spotting the signs of addiction and of spotting the signs of the fact that they are truly addicted, and what does that look like. So we have that. We do we do messaging within papers, websites, TikTok. We just, I don't know if it's launched yet, but it is the first time so we're under the city of Fargo. Fargo Cast Public Health is under the city of Fargo. It's the first time the city of Fargo has ever had like an ad on TikTok. So we're very excited to see how that goes. We do media interviews, like live. So we've been on North Dakota Today. We like to show all of our new products. And since the products are constantly changing, every time we go on, it's totally different. We've done live radio. Media we've found locally anyway really wants that information out there. And so they do whatever we request. They're very open to that. We also do community education. I think Haley referenced the fact that when EVALI was at the peak, the fall before COVID, we were doing a massive amount of presentations. We were in the schools in health classes, the school resource officers, teacher presentations, parent presentations, PTO and PTA presentations. You know, and those PTA presentations, parents they're invited to come to these presentations. And so I've had vape shop owners come to these presentations, Kiwanis and different community groups that really just look for education so that they can be informed about things happening, maybe with their grandkids, that type of thing. And then nursing and respiratory therapists. So we were incredibly busy that September, October, November, as far as presentations go. And that's kind of what we've just tried to target our education to students, but then also to teachers. And I have developed really good relationships with our school resource officers in all of Cass County, to the point of they'll text me a picture of a vape and say, have you seen this one? Or we will find out, or I will find out from our tobacco education class that this is the new product that kids are using. I'll go purchase it, or at least find a photo of it and text it to all of them. And it almost becomes like a scavenger hunt for those school resource officers. And typically within a couple days, I'll get a text back. Got one. We found one. So I really feel like those community educational pieces turn into community relationships, and that community relationship building is so incredibly important. I feel like once people know that you're the vaping person, you're the person to come to, it makes life a lot easier, because then that you are who they come to. So if you're not with local public health and you are in Cass County, you can always come to us for requests for vaping presentations or tobacco presentations in general. And then I encourage you, if you aren't in Cass County, to connect with your local public health unit and your tobacco coordinator, because making those connections and really starting to work on getting that education out there more and more is really incredibly important. Because I think it's Grand Forks, Bismarck, and Fargo talking to you today. So typically, you know, I can't remember if they all have vape shops. We have vape shops here. We have lots of tobacco retail stores as well, not just strictly vape shops. And we see a lot of this stuff before rural North Dakota sees it. And so I think, you know, if you can get that education out there sooner rather than later, you know, and then your own school resource officers, your own teachers will know what to look for, and try and head this off at the pass a little bit, because it's incredibly frightening. So with that being said, does anybody have any questions for Jordyn, Haley, or I about anything tobacco or vaping related?
And this is Jordyn. I just put in the chat information about the Campaign for Tobacco-Free Kids Summer Symposium. And so the link can be found there. And there was a question earlier in the chat about the age for the Youth Action Summit in Fargo and Bismarck. We target middle and high school students for that in particular. So good question.
This is Haley again, and I just wanted to also add that for folks that maybe haven't had a chance to dive really deep into what the data is telling us about which kids are using these. I know that Jordyn mentioned earlier, I believe in a buzz session, that these products are not, you know, it's not like back when we were younger and, you know, you could tell who the tobacco users were because you could smell it or see it, or there was a stereotype. This is something that every kid is, every pocket of children are using. And so much so that our rates are telling us that our kids are using these on a daily basis. And so when we were looking at rates back in 2011 and 2013, you know, those using them on a daily basis were quite low. They were more experimenting. And so over the years, we could see the data telling the story of experimentation all the way up through addiction. And so if there's anything that we really want to stress today is the use of the My Life, My Quit program. Jordyn, thank you for putting it in the chat because I think I said the wrong URL. So that's in the chat. But also your local public health units might be able to help you with print materials that you could deliver to either providers' offices or schools or anyone that would be interested in promoting this program to youth and or their parents, because again, they do have great resources on that website. But you know, our youth are using these products daily, and when you consider the fact that they can get a product that contains 2,200 puffs, it's not just once a day. So they are addicted to these products, and we want to make sure that we are plugging the My Life, My Quits with them as much as we can. So Jordyn, not to put you on the spot, but I think your story about your I'll just call it the hashtag side hustle. I think is pretty impactful. Would you mind sharing that with this larger group that may not have been in on the buzz sessions?
What Haley is referring to is here in our neck of the woods of Bismarck, we've had students, and I wouldn't be surprised if this is happening elsewhere, but kids are having their very own little side hustle and selling vape products to younger kids or their peers in their schools, and they're getting them from online or from even older sources. And earlier in Melissa's session, you know, she mentioned that these products are like about $10 when we're referring to the disposable vapes, $10 to $15. But kids, when they sell them, they're marking them up quite a bit, and they're selling them through Snapchat. I've had students say that they've seen posts for people selling their vapes on Snapchat and social media, and there's another app called, it's like VSCO, I think it is, that they try and sell or post pictures of vaping. And, you know, when kids are getting caught, you know that they're selling because our SROs are finding like definitely more than like 10 or more vapes on them. And so, yeah, they're figuring out their little side hustle, and selling to their younger peers, which is really unfortunate. And I wouldn't be surprised if it's happening in other areas as well.
So I was just going to say that there's 45 of you still on, so that means you're hanging with us. So that's good, but I have my kit of vapes right here. So I thought, well, I can just show you some of the vapes that we're seeing. Everything that I have here has been ticketed, not these maybe in specifically, but has been ticketed here in Fargo or Cass County and at some point. So we have the Vape Watch, and what happens with the Vape Watch is you just the faceplate pops off, and it charges like it will. Mine is not charged up right now, but the faceplate pops off, and it becomes a vaping device. Okay. So when we found out about this product, we immediately ordered one. And then I was doing a parent presentation about vapes and what to look for. And I held up the Vape Watch, and a foster dad said, oh my gosh, he was sitting next to his wife, and he said, he has a Vape Watch. He has a Vape Watch. Like, they couldn't wait to leave because he has the child that was in their care had a Vape Watch. And he said, I'm so mad at myself because he had asked his son about the watch because the faceplate was upside down. So he was wearing the watch upside down, like the time was upside down. So you can't read it if it's upside down, and it didn't matter. He's like, oh my gosh, it doesn't matter to him because that's not what he's wearing it for. So anyway, that child ended up having to come to my tobacco education class because he did get caught in school with it. But so we've seen the Vape Watch all over. I know when I talk about like looking for weird chargers and stuff, now this is a pod-based vape that looks very similar to a Juul. The vape itself was being sold. I'm not 100% sure if it's being sold for 99 cents anymore, but the device was being sold for 99 cents at local gas stations. That's where I got it. And then the pod devices, which they can't sell these anymore. But I always want to show parents, like, this is the kind of weird charger we're talking about. So you have no idea what this actually charges. Okay, it's got an opening, it magnetizes in there, it uses a USB, okay, and it just pops right in there. Okay, this is the type of thing that we want parents to be aware of. Although this pod-based system is not being utilized very heavily at the moment, you still need to be aware of it. We also have things like Bang energy drinks being copied. So this particular one is called Bubblegum Ice. So again, that ice name is added to a lot of different flavors for whatever reason. There must be, scientifically, I'm thinking that if you add ice to the name of something, it becomes that much more like you want it. You know, it sounds refreshing. It sounds good. I just want to check these questions. Okay, Joni's got some questions. If I could make one change to tobacco policy without resistance, what would it be and why? That's a really good question. And here in North Dakota, I would raise the tobacco tax, and I would, along with that, also have vaping products become tobacco products under our tax law, so that we can tax them as the tobacco products that they are. That would be my policy change without restriction or without any resistance. And then changes most achievable in the next few years. I don't know what's the most achievable. You'd think that getting vaping products to be tobacco products under our law wouldn't be that big of a deal. I do think that that's a very big, it's a possibility that we could get that done. But who knows? Session is two years away now again, so. chat. Oh, yes, usage data. Thank you, Haley. Yes, I mean, who knows? They know what we're talking about based on if our phone is sitting next to us. So these USB devices that you plug in, who knows what the company is gathering. I actually was told at one time, I'm trying to find my jewel, one of my jewels, because I have many jewels. I was actually told at one time that the jewel, so what's interesting is, okay, so this is a jewel charger and it has the 2 prongs in it. This is the bottom of the jewel, which has 4. So, you know, who knows what that is, what that's actually trying to figure out. But
and it's interesting that in many of the jewel related photos you see online show them plugged into a computer. So if you have a device plugged into a computer, the capability and possibility that it's sharing information with the computer and or the www is high.
the other thing that I didn't talk about in any of my presentations, but the big hiding spots for vapes, especially when they weren't using disposables, was plugged into the back of like a gaming device, because you can plug USBs in back there apparently, and if it's in the back, parents can't see it. Also, in the box spring of mattresses. So if you are a parent watching this today thinking, oh my gosh, I gotta get home. I gotta get home. Check those places, because students have told me that the box spring is the easiest and most common place for vapes to be hidden. Also clothes that are hanging up, because parents, or like jackets that are hanging up in pockets, because parents will look through like dirty laundry or like an underwear or sock drawer, but they won't look at clothing that's hanging up because it just doesn't come to mind. So I've been told that too. So there's a couple places you can go on a scavenger hunt when you get home tonight.
I just posted in the link to on where you can, or on what to look for vapes. Melissa actually had this in her prior presentation, but it's a really good handout and we've given it to schools. But for you as a parent, or if you know someone who has a younger child, or even, well, any age really, I guess right now, unfortunately, but just kind of give you an idea of the different products to look out for. There's a link in there in the chat box.
All right, you guys. So basically that comes full circle for our time. I do want to thank everyone for attending. Thank our presenters. Thank you guys so much for taking the time to come and share what you're doing, how things are progressing in this very much so continuing hot. It's been a hot topic for quite some time now, but continues to evolve, I think, in that way.